I'm Dr. Alice Epitopoulos from Columbus, Ohio. I want to talk with you about an innovative state-of-the-art treatment for dry eye disease and blepharitis. It's called BlephEx. This revolutionary technology allows patients the opportunity to take charge in their treatment. BlephEx is a simple 10-minute in-office procedure performed by your eye care practitioner. The procedure effectively removes the bacterial biofilm from the surface of the lid margin and glands that aid in the production of your natural tears. The goal of the BlephEx treatment is to reduce or alleviate your chronic debilitating symptoms, such as tearing, burning, irritation, itching, grittiness, and crusting. The good news is that many patients report improvement almost immediately after treatment. Just like your dentist removes plaque during a routine dental cleaning visit, BlephEx treatments need to be repeated at regular intervals, depending on the severity of the disease. By reducing the inflammatory trigger of dry eye disease and blepharitis, the overall health of the eyelid and tear film is improved. The goal is to begin producing more of your own natural tears and experience subsequent relief from the chronic and irritating symptoms associated with dry eye disease and blepharitis. While BlephEx is not currently covered by insurance, it is an affordable procedure, especially when compared to the long-term costs of dry eye treatment. If you have dry eye disease and blepharitis, you may not only save the money spent on over-the-counter eye drops, but enjoy the benefits of an effective, long-lasting treatment. Let me introduce you to one of my patients to share with you her experience with the BlephEx treatment.
My dry eyes predominantly have caused me to feel scratchiness and discomfort, predominantly in the morning, but also often at night. And it's been really uncomfortable. Most of the time I've tried to use something like some kind of drop, and eventually didn't do the trick. Well, first of all, the experience was a little scary at first, not knowing what it was going to entail. But eventually, once the procedure started, I realized that it felt so good that I didn't want it to stop. And afterward, it's interesting because pretty immediately, I felt a lot more moisture in my eyes, but I also didn't feel the scratching, and it was tremendous relief. And I had that for several months. It maintained itself for several months. And eventually I decided that I needed to get another one because A, it was so much fun, but also it helped so much. I've had a total of 3 so far, and more than willing to sign up for another. The procedure is actually very pleasant. It's cathartic, if you will, and it's very soothing. So just the procedure itself, even though it can be startling, the thought of it, is a pleasure.